Ever felt like your emotions are running the show, leaving you overwhelmed and impulsive? Borderline personality disorder, or BPD, can make everyday life feel like an emotional whirlwind. But there are ways to manage it, and we're here to help. Before we go ahead, let's first understand what borderline personality disorder really is. BPD is a mental illness that severely impacts a person's ability to regulate emotions. This loss of control can increase impulsivity, affect how a person feels about themselves, and negatively impact relationships. The good news: effective treatments are available to help manage these symptoms. Before we go ahead, don't forget to subscribe to our channel and hit the bell icon for more informative videos. So, what are the signs and symptoms of borderline personality disorder? We'll explain each symptom in detail and discuss how they can be managed for a better, healthier life. People with borderline personality disorder often experience intense mood swings, uncertainty about their self image, and shifting feelings toward others, moving from extreme closeness to extreme dislike. These emotional changes can lead to unstable relationships and emotional pain. Additionally, individuals with BPD may see things in extremes, viewing situations or people as either all good or all bad. Rapid changes in interests, values, and impulsive behaviors are also common. Let's dive into each symptom and explore how we can manage them for emotional stability and improved well being. Other signs or symptoms may include efforts to avoid real or perceived abandonment, such as plunging headfirst into relationships or ending them just as quickly. A pattern of intense and unstable relationships with family, friends, and loved ones. A distorted and unstable self-image or sense of self. Impulsive, risky behaviors like spending sprees, unsafe sex, substance abuse, and reckless driving can occur in BPD. If tied to high energy or mood, they may indicate a mood disorder, not BPD. Self-harming behavior, such as cutting. Recurring thoughts of suicidal behaviors or threats. Feelings of disassociation, such as feeling cut off from oneself, observing oneself from outside one's body, or feelings of unreality. Before we proceed, here is a quick Q&A of 5 questions. If you really think you're smart enough to answer them all, comment below. Let's see what you've got. To answer each question, you'll get only 10 seconds. If you want all the answers, comment below. Need answers now. So here is a question number 1. What kind of relationships do people with borderline personality disorder have? Question number 2. How is self-image affected in borderline personality disorder? Question number 3. What are some impulsive behaviors in borderline personality disorder? Question number 4. How are the moods in borderline personality disorder? And last question of this Q&A: what is dissociation in borderline personality disorder? Congratulations, you've completed all 5 questions. If you want to cross-check your answers, comment down below and write "Need answers now." Now, let's understand how borderline personality disorder is diagnosed. A licensed mental health professional, such as a psychiatrist, psychologist, or clinical social worker, will conduct a thorough interview to discuss symptoms and assess the individual's mental health. A detailed medical exam helps rule out other conditions, and family history is reviewed to provide further insights. BPD is usually diagnosed in late adolescence or early adulthood, though in some cases, it can be diagnosed in individuals younger than 18 if severe symptoms persist for at least a year. What other illnesses can co-occur with borderline personality disorder? Borderline personality disorder often occurs with other mental illnesses, such as post-traumatic stress disorder. These co-occurring disorders can make it harder to diagnose and treat borderline personality disorder, especially if symptoms of other illnesses overlap with symptoms of the disorder. Here's an example to help you understand better. A person with borderline personality disorder may also be more likely to experience symptoms of major depression, PTSD, bipolar disorder, anxiety disorders, substance abuse, or eating disorders. These co-occurring conditions make it harder to diagnose and treat BPD effectively. Watch more videos for insights. Don't forget to like, comment, and share. Moving forward, now let's understand how borderline personality disorder is treated. Borderline personality disorder has historically been viewed as challenging to treat. However, with modern, evidence-based treatments, many individuals experience fewer and less severe symptoms. These treatments can lead to improved daily functioning and an overall better quality of life for those affected by the disorder. It's essential that patients receive care from a licensed mental health professional, as untrained providers or incorrect treatments can be ineffective or even harmful. Many factors affect the length of time it takes for symptoms to improve once treatment begins. It is important for people with borderline personality disorder and their loved ones to be patient and receive support during treatment. Let's talk about psychotherapy. Psychotherapy, also known as talk therapy, is the first-line treatment for individuals with borderline personality disorder. It typically involves one-on-one sessions with a licensed mental health professional. Group sessions are also common, helping those with borderline personality disorder learn to interact with others and express themselves more effectively. Let's understand with two examples of psychotherapies used to treat borderline personality disorder. First example is dialectical behavior therapy, DBT. Developed for treating borderline personality disorder, DBT emphasizes mindfulness and awareness of one's emotions. It helps individuals manage intense emotions, reduce self-destructive behaviors, and improve relationships. And second example is cognitive behavioral therapy, CBT. CBT helps individuals identify and change distorted beliefs and behaviors, improving interactions with others. It can reduce mood swings, anxiety, and self-harming or suicidal behaviors. Now let's talk about medication. For better understanding, we've divided it into 4 parts. Number 1. While medications are not the primary treatment for borderline personality disorder, BPD, due to unclear benefits, they may be prescribed to manage specific symptoms or co-occurring mental health conditions like depression, anxiety, mood swings, or impulsive behaviors. Number 2. Commonly used medications for BPD may include antidepressants, mood stabilizers, or antipsychotics, depending on the individual's needs and the symptoms they are experiencing. Number 3. It's important to note that medication alone is rarely effective for BPD. It is typically combined with psychotherapy to achieve better treatment outcomes and improve the individual's quality of life. Number 4. Additionally, treatment with medication often requires coordinated care between a psychiatrist and other medical professionals to monitor progress, adjust medications, and avoid side effects or complications. Therapy for caregivers and family members. Caring for a loved one with borderline personality disorder can be challenging and emotionally taxing for family members. Involving the family in treatment, especially through family therapy, can provide crucial support for both the individual and their loved ones. Let's break it down into 4 key parts to better understand how family therapy can support both the individual and their loved ones. Part 1. Caring for a loved one with BPD can strain family relationships, as even well-meaning actions can worsen symptoms or trigger emotional instability, leading to frustration and burnout. Part 2. While more research is needed on family therapy for BPD, Studies on other mental disorders show that involving family in treatment improves communication and understanding. Part 3. Family therapy not only supports the person with BPD but also equips family members with tools to manage challenges, reduce stress, and avoid burnout. Part 4. Therapy teaches coping strategies, helps set boundaries, and fosters better communication, leading to a more stable, supportive environment and improved outcomes for everyone involved. How you can help a family member or friend suffering from borderline personality disorder. Here are a few ways to support your loved one. Learn about the disorder. Take time to educate yourself to better understand what they're experiencing and how to approach it with empathy. Provide emotional support. Be patient, offer encouragement, and let them know you're there for them as they navigate the challenges of BPD. Encourage therapy. Suggest they explore family therapy to improve communication and relationships. Seek support for yourself. Find your own therapist to help you manage the emotional strain of supporting someone with BPD. Now here are 5 myths and truths about helping someone with borderline personality disorder. Myth number 1: people with BPD are just being dramatic. Truth: BPD involves real emotional distress, not attention-seeking behavior. Their intense reactions are part of the disorder and not an over-exaggeration. Myth number 2: if someone with BPD pushes you away, they don't need your support. Truth: people with BPD may push loved ones away due to fear of abandonment. Consistent support and patience can help them feel secure. Myth number 3: only professionals can help. Truth: while professional treatment is crucial, loved ones play an essential role by offering emotional support, understanding, and encouragement. Myth number 4: people with BPD cannot improve. Truth: with the right treatment and support, many individuals with BPD experience significant improvement and lead stable, fulfilling lives. Myth number 5: setting boundaries is harmful to someone with BPD. Truth: healthy boundaries are beneficial. They protect both you and the person with BPD, fostering trust and stability in the relationship. How long does it typically take for someone with BPD to see improvement in their symptoms through therapy? Individuals with borderline personality disorder, BPD, can recover or manage their symptoms effectively over time, especially with the right treatment and support. While BPD can be challenging, many people experience significant improvement in their emotional regulation, relationships, and overall functioning. One of the most effective treatments for BPD is dialectical behavior therapy, DBT, which teaches skills like mindfulness, emotional regulation, and distress tolerance. With consistent therapy, many individuals learn how to manage their impulsive behaviors and intense emotions. Let's understand with example a person with BPD who once struggled with constant mood swings and unstable relationships might, after a year of DBT, develop the ability to pause and reflect before reacting. This allows them to communicate more effectively with loved ones, maintaining healthier and more stable relationships. Example number 2: another individual with BPD who frequently experienced self-harm urges could, through treatment, learn to use distress tolerance skills to cope with emotional pain. Over time, they may reduce these urges significantly, allowing them to lead a safer and more balanced life. Do we have any self-care techniques to handle borderline personality disorder? The answer is yes. There are several self-care techniques that can help manage borderline personality disorder. Practice mindfulness. We can use mindfulness to stay in the present moment, helping to reduce emotional intensity. Simple practices like deep breathing, meditation, or mindful walking can ground us when emotions feel overwhelming. Regulate our emotions. We can learn to manage emotions by recognizing and labeling them. Techniques from dialectical behavior therapy, DBT, such as opposite action, acting opposite to what we feel, can help when emotions are intense. Stick to a routine. Establishing a daily routine can provide us with stability and structure. Having a predictable schedule can help reduce impulsive behaviors and provide a sense of control. Set healthy boundaries. We can practice setting boundaries in our relationships to protect our emotional health. Clear and respectful boundaries can reduce conflict and prevent emotional overwhelm. Show ourselves compassion. We can practice self-compassion by being kind and forgiving toward ourselves, especially during emotional challenges. Treating ourselves with understanding can counter the negative self-image often associated with BPD. Here are 5 risk factors associated with the development of borderline personality disorder. Research indicates that BPD can run in families, suggesting a hereditary component. Individuals with a family history of BPD or other mental health disorders, such as depression or anxiety, may have a higher risk of developing BPD. Genetic predispositions can influence brain chemistry and personality traits, increasing vulnerability to the disorder. Traumatic experiences during childhood, such as physical, emotional, or sexual abuse, neglect, or abandonment, are significant risk factors for BPD. Unstable family environments, including parental substance abuse, mental illness, or domestic violence, can also contribute to the development of the disorder. These adverse experiences can lead to difficulties in emotional regulation and attachment, which are core features of BPD. Certain personality traits, such as high levels of impulsivity and emotional sensitivity, can increase the risk of developing BPD. Individuals who struggle with low self-esteem, chronic feelings of emptiness, or difficulties in self-identity may be more susceptible to the disorder. Psychological vulnerabilities can influence how individuals cope with stress and interpersonal relationships. Brain structure and function may play a role in BPD. Research has shown that individuals with BPD may have abnormalities in areas of the brain involved in emotion regulation, impulse control, and interpersonal functioning, such as the amygdala and prefrontal cortex. These neurobiological differences can contribute to the emotional instability and impulsivity characteristic of BPD. Cultural and societal factors. Cultural norms and societal expectations can impact the expression and prevalence of BPD. For instance, individuals from cultures that discourage emotional expression may be less likely to seek help for emotional dysregulation or relationship issues. Additionally, stigma surrounding mental health can prevent individuals from accessing necessary treatment, leading to untreated symptoms and exacerbation of the disorder. Before we go ahead, don't forget to like, subscribe, and hit the bell icon so you never miss an update. What are some misconceptions about borderline personality disorder? BPD is just a phase. Many believe that BPD is a temporary condition that individuals will outgrow. In reality, BPD is a serious mental health disorder that requires treatment and can persist throughout a person's life without intervention. People with BPD are manipulative. This misconception arises from the intense emotional responses and behaviors seen in individuals with BPD. However, these behaviors often stem from deep-seated fears of abandonment and emotional pain, rather than a desire to manipulate others. BPD only affects women. While BPD is more frequently diagnosed in women, it can affect anyone, regardless of gender. Men may be underdiagnosed due to differing symptom presentations and societal stigmas. Individuals with BPD cannot form healthy relationships. While BPD can create challenges in relationships, many individuals with the disorder can and do develop meaningful connections with others, especially with appropriate treatment and support. BPD is untreatable. Although BPD is a complex disorder, it is treatable. Therapies like dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT, have shown effectiveness in helping individuals manage symptoms and improve their quality of life. Let's understand what not to do when someone is suffering from borderline personality disorder. Don't dismiss their feelings. Avoid belittling or minimizing their emotions. Instead, validate their feelings and show empathy. Don't label or judge. Refrain from calling them dramatic or manipulative. Understand that their behaviors stem from deep emotional pain. Don't engage in power struggles. Avoid arguing or trying to control the situation. Stay calm and composed to prevent escalation. Don't make ultimatums. Avoid threatening or placing demands on them, as this can lead to increased feelings of abandonment. Don't take their behavior personally. Remember that their reactions are often a reflection of their inner turmoil, not a personal attack on you. Don't enable harmful behaviors. While providing support, avoid encouraging self-destructive behaviors. Instead, promote seeking professional help. Don't try to fix them. Focus on listening and being present rather than attempting to solve their problems or change their behaviors. Don't isolate them. Avoid withdrawing or creating distance. Stay connected and encourage open communication to help them feel supported. What are the common challenges faced by individuals with BPD in social situations? Here are 10 detailed points on the common challenges faced by individuals with borderline personality disorder. Fear of rejection or abandonment. Individuals with BPD often live with an intense and pervasive fear of being abandoned or rejected, even in minor or routine social interactions. This fear can make them hypersensitive to any perceived sign that others may be pulling away. Emotional reactivity. Emotional regulation is a core struggle for people with BPD, and this becomes evident in social situations. They may experience sudden and overwhelming emotional reactions to perceived slights, criticism, or misunderstandings. A minor comment can trigger an extreme emotional outburst, and their mood may shift rapidly from calm to angry or distressed. This heightened emotional sensitivity can make interactions unpredictable and challenging for both the individual and difficulty trusting others. Trust issues are common among those with BPD. Past experiences of betrayal or abandonment may contribute to a deep-seated fear of trusting others, even when there's no reason to be suspicious. This lack of trust can make them suspicious or paranoid about the motives of friends, family, or partners, leading to strained relationships. Constantly questioning others' loyalty can push people away and create further isolation. Black and white thinking, splitting. Individuals with BPD often engage in splitting, a defense mechanism where they view others in extreme terms, either as entirely good or completely bad. This black and white thinking can lead to unstable relationships because their perceptions of others shift quickly and dramatically. Fear of intimacy and vulnerability. While individuals with BPD often crave close relationships and intimacy, they simultaneously fear being hurt, rejected, or abandoned by those they care about. This creates a push-pull dynamic, where they may alternately seek closeness and then push others away out of fear of becoming too vulnerable. Impulsivity in social interactions. Impulsivity is a hallmark of BPD and often manifests in social situations. Individuals may act without thinking, saying hurtful things, making rash decisions, or engaging in risky behaviors, such as substance abuse or reckless spending. Unstable self-image. People with BPD often have an unstable or unclear sense of self, which affects their ability to interact consistently in social settings. Their self-identity may shift frequently, leading them to change opinions, behaviors, or even their personality to fit in with different social groups. This lack of a stable sense of self can cause confusion for both the individual and others, making it difficult to form authentic, lasting connections. Sensitivity to criticism. Individuals with BPD are highly sensitive to criticism, whether real or perceived. Even well-intentioned feedback can be interpreted as an attack, leading to feelings of inadequacy, shame, or anger. This hypersensitivity can make social interactions feel like a minefield, as they may withdraw or lash out in response to perceived criticism. As a result, people with BPD may struggle to maintain friendships or professional relationships. Idealization and devaluation in relationships. One of the most challenging aspects of BPD is the tendency to oscillate between idealizing others, putting them on a pedestal, and devaluing them, seeing them as unworthy or harmful. This rapid shift in perception can be confusing for friends, family, and partners. One moment, they may be seen as perfect and indispensable, and the next, they may be harshly criticized or pushed away. Fear of being alone. People with BPD often have an overwhelming fear of being alone, which can drive them to stay in unhealthy or toxic relationships simply to avoid the feeling of isolation. They may cling to others or go to great lengths to avoid being left alone, even if it means tolerating negative behaviors. Here are 10 detailed points discussing how symptoms of borderline personality disorder may improve with age. Increased emotional regulation. As individuals with BPD mature, they often develop better emotional regulation skills. Over time, life experiences can teach them to manage intense emotions more effectively, reducing instances of emotional dysregulation that characterize BPD. This growth can be facilitated through therapy, mindfulness practices, and coping strategies learned throughout adulthood. Enhanced relationship skills. With age, many individuals gain more experience in interpersonal relationships, which can help them develop healthier attachment styles. Over time, they may learn to set boundaries, communicate more effectively, and establish deeper connections with others, leading to more stable relationships and a decreased sense of abandonment. Greater self-awareness. Maturity often brings greater self-awareness, allowing individuals with BPD to recognize their triggers and patterns of behavior. This awareness can lead to more proactive management of symptoms and a better understanding of how their actions affect themselves and others, leading to improved coping strategies. Stability in life circumstances. As people grow older, their life circumstances may stabilize. Factors such as career advancement, settled living situations, and long-term relationships can contribute to a sense of stability, which may help mitigate some BPD symptoms. A more stable environment can foster emotional security and reduce stressors that exacerbate symptoms. Therapeutic progress. Individuals with BPD often engage in therapy over the years, which can lead to significant improvements in symptoms. Therapeutic modalities such as dialectical behavior therapy, DBT, are specifically designed for BPD and can help individuals develop skills to cope with their emotions and relationships. Continued therapy and practice of these skills can lead to lasting change. Development of coping mechanisms. As individuals age, they often learn and adopt more effective coping mechanisms to deal with stress and emotional pain. These skills can include healthy self-soothing techniques, assertiveness training, and problem-solving strategies, which help reduce impulsive behavior and emotional reactivity. Reduction of impulsivity. Many individuals with BPD experience impulsive behaviors, especially during their younger years. With age, there is often a natural decline in impulsivity, as individuals learn to weigh consequences more effectively. This can lead to more thoughtful decision-making and a decrease in risky behaviors. As people progress through life, they often undergo shifts in their identity and values, which can contribute to a more cohesive sense of self. This development can reduce the identity disturbances commonly associated with BPD, leading to greater self-acceptance and a clearer understanding of personal goals and desires. Support networks. Over time, individuals often build more substantial support networks, including friends, family, and community connections. These relationships can provide emotional support, understanding, and resources that contribute to better mental health and a decrease in BPD symptoms. Hormonal and biological changes. Aging is accompanied by various hormonal and biological changes that may influence mood and behavior. Some studies suggest that hormonal shifts in women, especially during perimenopause and menopause, can lead to changes in emotional regulation and a reduction in some BPD symptoms. These biological changes, combined with the psychological growth that often accompanies aging, can lead to improvements in overall mental health. Thank you for watching our video. We hope you found it valuable. If you enjoyed it, please consider subscribing to our channel and hitting the bell icon so you never miss an update. Your support means a lot to us.